I'm about to perform a shave biopsy, and in this particular scenario, we're going to do a saucerization. The technical difference is that the shave biopsy tends to be done with a straight blade razor, like a 15 blade surgical knife or a 10 blade, whereas the saucerization tends to be done with a special instrument called a biopsy blade. And the difference is the saucerization tends to be a little deeper and a little more controlled. So we're going to talk about the techniques for setting up, using the actual instrumentation, and then specimen collection. Using this technique of a shave biopsy with a 15 surgical blade, first of all, the skin is prepped with alcohol. A localized wheel is raised with anesthetic. Then we start outside of the area by about 2 or 3 millimeters. We score the skin, and then we simply shave across the entire process and remove this, always trying to be in the dermal junction, not into the subcutaneous fat. For this demonstration, we're going to use a biopsy blade or a saucerization shave tool with the same general concepts. We start on the outside of this in normal tissue, and we start with using a sawing motion, gently going back and forth as we push across. And this sawing motion continues until we're approximately halfway through, and then we continue up and we finish off the biopsy with a little twist. Sometimes the lesion won't come off completely, and so you might want to gently remove that edge or cut it again. And that's all the process of just getting a full-size biopsy, trying not to handle it too much, but that's the technique. Trying to hold it within the normal tissue, not within the pigmented lesion itself. So once we've taken the specimen off, we would put that in the transport medium to send to the lab. And then we would cover this area with a sterile dressing. You could use an antibiotic solution or ointment and put a Band-Aid on and have the patient remove this in 48 hours and put a new Band-Aid on. This usually is very superficial and heals quickly as long as you didn't go into the deep fascia subcutaneous tissue.